Let's build a logistic regression model in Python to help you better understand how it works. I want you to imagine for a second that you're a doctor in a busy clinic and patients keep coming up all day with something that could be a potentially serious illness or just them over-exaggerating their symptoms. But you simply just do not have the time or resources to order an expensive, definitive test for every patient, so you need a super fast, super efficient, and super accurate method that determines who is high risk and who is low risk quickly. So eventually you decide to turn to the magic of the logistic regression machine learning method in Python. So let's break it down. This first block here is just us setting up our clinic tools before any patient even walks in. There are libraries. Pandas is just a neat charting system that lets you store your patient details in a clean database. And logistic regression from scikit-learn is the tool we'll use to train our model. Right here, we're basically accessing a tiny file of past patient history, so the model can learn from what actually happened in the past. Each row is one patient, and each column is a medical detail about that patient, like their age, blood glucose levels, and whether symptoms like fever or excessive thirst are present. The last column is the target, which is what makes the training possible because it tells the model what actually happened in reality. In this case, a target value of 1 signals that a patient had diabetes, and a target value of 0 signals that they did not. With these values, the model can now learn the patterns that tend to show up when the disease is present versus when it's not, and help us make predictions. Right here is where we're telling the model very clearly, this is what you're allowed to look at when the patient walks in, and this is what you're trying to predict. The input table is called X, and it holds all of the patient's medical details, which are the features. And the target is called Y, and it is the final diagnosis for the patients, letting the model know if they did or did not have diabetes. And this is exactly what the model will be trying to predict. Conceptually, this matters because the model needs to know exactly what inputs are most important for predicting that output. And this helps it build consistent rules, like blood glucose might matter a lot, while fever doesn't really matter that much when it comes to predicting diabetes. And if any of this is confusing, then make sure you check out part 1 of this video for a full logistic regression debrief. Now this block right here is where we're jumping into the model training, and it's when our screening assistant learns how to think and in a very specific way. Essentially, it's trying to create a singular raw risk score that the patient has diabetes. Firstly, it learns how important an input or clue actually is, and then it assigns that input a weight based on what it found. If it learns that high blood glucose levels are a very strong predictor for diabetes, then blood glucose will have a very big weight. And this means a larger glucose input would push the risk score up way more than a weaker input would. And it goes through every single input and assigns it its own individual weight. Then it multiplies each input by its weight, adds all those pieces together, and adds a baseline on top of that. And the final result is the raw risk score that the patient has diabetes. Now, this raw risk score can be anything. It can be 1.6, negative 0.8, but what we actually want is a probability that sits between 0 and 1 that tells us how likely it is that the patient is sick. So the model runs this raw risk score through a sigmoid function that does exactly that. And the training process of logistic regression is just the model continuously adjusting and fixing the weights so that patients who actually did have diabetes end up with higher probabilities and patients who didn't end up with lower probabilities. It repeats these adjustments until it finds the almost perfect weights that best represent the dataset. The last block here is where you're asking the model, what did you actually end up learning from all these training cases? It's going to report to us the intercept and all the weights that it decided on. Here the model chose an intercept of 0.2 and decided that glucose levels and excessive thirst levels should have very large weights because they matter a ton when it comes to predicting diabetes. And now we can actually use our model like we would in real life. So we're inputting a patient's data. They're 35 years old with a high glucose level, no fever, and they do have excessive thirst. And lo and behold, the model predicts that this patient does have diabetes with a 99% certainty. And that is a full workflow of a logistic regression model from dataset to prediction. So if you learned something from this video, then don't forget to save it for your next logistic regression model and follow for more. See you in the next one.